Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today I want to talk about a very sobering issue, and that is the people that we've deemed the losers, for want of a better term, in our healthcare coverage system. And the point isn't to label anyone with anything, it's just to show in this description of winners and losers that coverage can be so different problems associated with it. Or, as in our first category, the absence of coverage. So that's the most significant group, the uninsured. People who don't have coverage are at great financial risk if they need medical services and have no coverage. And there are different reasons people end up without coverage. Surely one today that I think is probably a growing problem are people who actually have income, but they're facing the kind of premiums that we described in the previous video of the couple who've gotten their renewal notice, and it's essentially $3,000 a month for the two of them with the $6,000 deductible. There are people who will say that's just not affordable. At the same time, you have very low income people in situations where they don't have control of the situation. We won't focus on the cavalier who just haven't bothered to see what they're entitled to. But people in the states that didn't expand Medicaid under the Affordable Care Act, there's a group of relatively low-income people who make more in income than the threshold for their state's Medicaid program, but don't make enough to be eligible to buy coverage on an exchange or marketplace that is subsidized. So that's quite unfortunate. I would also mention the category of people who have bought coverage and have no subsidy, so they're paying quite substantial amounts of money for it, but they had to choose a product that they don't find that desirable in terms of the network. You know, a good example would be a state like New Jersey, where many people have doctors in New York, but there's no product an individual can buy as an individual in New Jersey that covers doctors in New York, except for urgent and emergent circumstances. So in those situations, people are paying a great deal for individual coverage, but they're either paying for their former doctors out of pocket or they've changed doctors. And then the last category I would mention, and I know it's controversial, but hard to dispute, that women of childbearing age in states that have severely restricted access to abortion are in a very tough coverage situation, especially those difficult, awful situations where the health of the mother might be at risk due to the pregnancy. And clearly that is going to be a difficult topic for Americans for years to come. And so we'll be talking about it again, but they deserve to be identified as a group in a difficult situation because, you know, on the one hand, if they're covered, no matter what the state has done, the Affordable Care Act policies, and most policies are Affordable Care Act compliant, give people access to emergency services, but the whole situation is murky and difficult and challenged. And I think most Americans have more agreement on those extreme situations where the mother's at risk. Less about others, but anyway, very, very, very tough situation for those people. So I'm sorry for such a depressing topic today, but again, the point is for everyone to understand coverage is not the same. Coverage is very, very different with very different challenges. So thank you for watching. Thank you for staying with us. And I look forward to seeing you again in the future. Take care. Bye-bye.